Today, we will be talking about a posterior pelvic tilt during squats. In this video, compensations, biomechanical causes, flexibility limitations, and 5 corrective strategies will be discussed to help improve your squat. A posterior pelvic tilt occurs when the pelvis is tilted backwards, causing excessive lumbar kyphosis when reaching the bottom of a squat. This leads to compensations like lumbar spine flexion, knee valgus, foot pronation, and lateral translation. Lumbar spine flexion is when there is an excessive rounding of the lumbar spine, which over time can cause lower back pain or even herniation. Next, we have knee valgus, which is when the knee turns inward in connection to the toes. This is caused by poor activation of the gluteus maximus, gluteus medius, and pelvic stabilization, which causes the femur to collapse and go into internal rotation. Foot pronation is the rolling of the foot going inward trying to find stability in the squat. Having limited stability at the knees and hips causes the subtalar joint to go into pronation. For the final compensation, we have lateral translation, which is when the pelvis is shifted laterally to one side. This is caused by either or both weakness or tightness in the hip abductors, which include the gluteus medius and minimus. An uneven distribution of force goes through the hip, knee, and ankle joints. We will now get into 5 corrective exercises using static and dynamic movements. The first exercise is a pigeon pose stretch. Start in a tabletop position. Bring your right knee forward, placing it behind your right wrist. Extend your left leg straight behind you. Lean forward slightly and hold for 30 seconds. Keep your pelvis squared and avoid rotating to one side. Next is a seated hamstring stretch, which reduces tightness in the hamstrings. Sit with your legs straight and extended in front of you. Maintain a neutral pelvis and reach for your toes or ankles. Feel the stretch and hold for 30 seconds. Imagine lifting your chest upward as you hinge forward. Next exercise is the cat-cow stretch, which helps improve spinal mobility and increase awareness of pelvic positioning. Start on all fours. Move into a cow position, which is arching your back, lifting your tailbone, which shows an anterior pelvic tilt. Then transition into a cat pose, which is tucking in your pelvis, which engages the rectus abdominis and shows a posterior tilt. Feel the transition between the anterior and posterior tilt as you engage and release your core. The next exercise is a deep squat hold with torso twist. This helps increase hip flexion and improve thoracic mobility. Drop into a deep squat with feet shoulder width apart. Place one hand on the floor. Twist your torso and reach your opposite arm upward. This helps with thoracic rotation. Keep your chest up and weight evenly distributed so you do not collapse forward. The final exercise is deep squat hold with thoracic extension. This helps with proper pelvic positioning. Drop into a deep squat with your feet flat on the ground. Bring your arms overhead. Hold for 30 seconds and remain in a neutral pelvis and lumbar and spine position. Imagine sitting deep into your hips with your spine long and pelvis neutral.